Hello?
What's the countdown?
The countdown's done. It was just said 3, 2, 1.
Oh.
Hi, everyone. Can anyone hear me? Oh, wait. Or put in a comment, I guess. We have one viewer. Is that just me?
It's me.
Huh?
It's me.
Oh, it's Kylie. Oh, we have 2 viewers.
Okay.
Welcome, Kylie. Welcome, Melanie. Okay. Do I need to do something with the current frame? I'm just gonna ignore that. We have 8 viewers. Hi. Welcome to Sleep 101 from the American Stroke Foundation. My name is Muzna. I'm an occupational therapist. So occupational therapy is the discipline that helps you work on everyday life. Anything that occupies your time is relevant to occupational therapy. Hi, Rosemary. And I wanted to talk a little bit about sleep because the majority of Americans have some sort of sleep disturbance. And after a stroke or any other event where your brain is impacted, sleep is also usually impacted. So this is our first Facebook Live, and we hope to make this a weekly, event every Thursday at 11. So I just am looking at everyone signing in. Hi, Kelly. Says we have 23 viewers. Yay! Okay, so does anyone have, I guess I'll start a little bit, just a brief kind of overview of sleep and how we frame changes in sleep, and then we can start with the questions. Good morning, Allison and Daniel. I like that little Snoopy that Kelly put. Hi, Audrey. Oh, she says, I'm so glad I found you. Okay, my enthusiasm is going to be like a little crazy because it's the first time I'm doing Facebook Live. Welcome, Audrey. Okay, so sleep. We spend a third of our lives in sleep-related behaviors. So that's a big chunk. So if you are not waking up feeling rested, then it's time to look at your sleep. The general frame of reference that we use is we talk about, I'm not sleeping 8 hours a night or 7 to 8 hours or whatever the guidance is. But how long you sleep is usually is not the best indicator of quality of sleep. So if you start to work on sleep, duration of sleep is the last thing that changes. If you are tracking improvements in sleep, changes in sleep, you want to track how you feel when you wake up, not how long you're sleeping. That is going to be the most useful information for you and your provider. So that's the first thing I think that I've learned in working with sleep with people with stroke or any other neurological change is pay attention to how you feel when you wake up. If you don't feel rested, then it's time to kind of start looking at your sleep. So you can do that in many ways. You can do a sleep log. You can ask your sleep partner if you are having any sleep disturbances, or you can talk to your doctor. If you've had a stroke, that is more than enough reason to have a sleep-related discussion with your doctor. All right. Hi, Angela. So, sleep studies is something that we've all heard about. Usually people think a sleep study is only relevant if you have sleep apnea or if you're snoring or if you're overweight. But a sleep study can give you much more information other than whether or not you have sleep apnea. It also tells you about how much time you've been spending in each stage of sleep. It can also tell you about limb movement. It can tell you about how your brain is working. So a lot of important information. So let's start with the questions. Please feel free to start typing in your questions in the comments section. If you have any questions about changes you've experienced after stroke, or if you have any specific questions about a sleep study, Please start typing them in so we can get them addressed. Hi, Carlos. Um, Sleep is definitely worth the investment. So if we're talking about after a stroke, one of the common things that people talk about is it's hard to get comfortable. So if you have a side that's hemiplegic, one side is weaker, or if you have tone or spasticity, then getting comfortable is difficult. And the position that you prefer, whether it's side sleeping or on your back or on your stomach, may not be possible with a stroke. So the goal is not to um, be in a position that's like doctor recommended or anything like that. The goal is to find the balance between your position of comfort, which is what you're going to default to regardless of what you do at the beginning of sleep, and what's going to be best for management of your tone or spasticity or keeping your arms safe, or keeping the rest of your body comfortable. Has anyone had any trouble with sleep positioning after stroke? We'll wait for those questions to come. The something that I like to talk about with sleep as an introduction, like how do you have a conversation with your doctor or how do you frame it? There's something called the 3-factor model of insomnia. Angela says yes, she's had changes. I sleep sitting up, it's comfortable for me. Okay. Melanie also has had sleep changes. Do you have specific questions? Please let me know. Angela says, we learned the hard way that CPAP does not work for central sleep apnea, changed to a BiPAP, and has made a huge difference. So that's a good point. A CPAP is a continuous pressure airway device, and so the pressure going in is the same as the pressure going out. A BiPAP that Angela is referring to has different pressure going in than out. And then there's also something called an auto PAP, which means that the pressure going in and out is dependent on what you're doing. So definitely talk to your sleep doctor. The person who actually gets you the sleep equipment may not know the best option. So I would default on I would err on the side of caution and always ask for an auto PAP, because that way you can adjust it versus being stuck with constant airflow on a CPAP. Melanie says, my biggest problem is the night terrors after stroke, and the CPAP doesn't work for me. So Melanie, did you have night terrors before the stroke? So night terrors are multifactorial, right? If they've only happened after the stroke, then definitely, your stroke experience and the fear of something happening again during night can definitely be an aspect. Night terrors sometimes also develop after a change in the brain chemistry. So your brain is trying to work through a lot of stuff. The neural pathways are trying to get reformed, and so night terrors can be a byproduct of that. So I would advise talking with your doctor and also working with someone in the mental health field. So for emotional health, that's something you definitely want to talk about, because those are changes in your brain and body that are trying to get your attention, and they just don't go away by wishing them away, right? Melanie says, I had my stroke while I was sleeping and woke up paralyzed. Yeah, that's very scary. So definitely having the night terrors is related to that, because you went to sleep one way, you were not conscious when stuff started happening, and stuff was outside of your control. So it's definitely related. Your thoughts impact how your body responds, and vice versa. So feeling safe enough to talk to someone, whether it's friends or family or a provider, or even journaling, to kind of just write out your thoughts. The purpose is not to have anything specifically organized or anything, but a safe place to get your feelings and your fears, and then working through that with someone you trust. What did I miss? There was.
Just this comment about. This
Oh,
one here.
okay. So Audrey says, I'm a caregiver for my husband who had a stroke a year ago. He likes to sleep on his side but can't. While he'd prefer, it seems to sleep okay on his back. He's in a hospital bed. My question is, let's see. Is it best to let him sleep and wait to get up? I hope that his brain, yes. So regardless of how they're sleeping, it's best to let them sleep. After any kind of injury, especially a neurological injury, sleep is important. If you have questions about how long they should be sleeping or how much sleep is too much, or when it's appropriate to wake them up and get them involved in activity, definitely you want to check with your medical provider. The brain does heal, you're right. The brain does heal while you sleep. At a certain point, that extra sleep can impact the ability to re-engage mentally and physically, so you definitely want to touch base with your medical team. Daniel says, I have no feeling on my left side and just can't get comfortable. So that's also very common. So one question that I ask everyone is, how comfortable was your bed before the stroke, right? Did you wake up with pain? Were you tossing and turning? Were you able to stay asleep during the night and not wake up due to the physical, actual environment of the bed? And then if you have no feeling on your left side, the general guidance would be to sleep on your strong side, because you don't want, even though you can't feel anything on your left side, you don't want that full weight on your left side when you're not getting the same feedback. So trying side sleeping with a body pillow. Body pillows are great. A lot of pregnant women use them because they can't get comfortable and they have pain in areas that they never had before they were pregnant. And the pillow doesn't change that, right? The pillow doesn't change their anatomy or anything like that, but it helps with pressure points. So it lets you offload where you need to offload. So I really recommend people try out a body pillow, or just get a really big pillow and wrap yourself around it and see if you can get in a more comfortable position. You can also try a pillow between your knees, because if you put your midsection and your trunk in alignment, everything else tends to fall in line with it. So definitely a body pillow would be my number one recommendation for experimenting with that. And then making sure you're comfortable. If you're not, if you're too cold, if you're too warm, that affects comfort, right? When you're sleeping, you're registering a lot of things and you're sleeping. So it's not like you take active action. For really making sure that your sheets are comfortable, you like the sensation, you're not waking up in a cold sweat or super hot. So just experimenting it, making it really like a cocoon and comfortable, because we all gravitate towards like a fetal position when we're not comfortable. Okay, you're welcome, Daniel. Did I miss any questions? Okay. We have 19 people viewing. That's great. So some things that you keep the questions coming, and we'll answering them. We'll make sure we get all of them. So some things you want to keep track of when you're talking about sleep is you want to keep track of when you're getting into bed, about when you fall asleep, how many times you wake up, what time you wake up, what time you actually get out of bed. You want to keep track of nightmares. You want to keep track of medications, caffeine, exercise, snoring. Are you waking up super hot? Are you waking up super cold? Do you feel safe in your sleep environment? So if you had a stroke during your sleep, or the symptoms started during your sleep, then yeah, that's going to impact how much you look forward to going to sleep and how comfortable you feel. Is your bed actually comfortable? Is your bedroom a sanctuary, or is it also your office? And does it have laundry, and does it have your mail? So you really want to take a look and create an environment that's conducive to actually unwinding. Angela says, I had just laid down to go to sleep when I had my aneurysm and stroke. Almost 2 years post, not just now able to sleep on the left side. So left side, it sounds like, is your position of comfort. So I'm glad you're able to sleep on that. If you have any advice, Angela, on how you were able to make that transition, please feel free to comment. It's amazing, like the things that we that are so little that we don't put attention to before, how much of a difference they make when we're trying to get comfortable, especially for something like sleep. It's such a big part of our life, and it impacts the rest of our day so much that if you are hesitant to go to sleep, if you don't look forward to going to sleep, if you feel like there's no point in going to sleep because you're not going to sleep well, it definitely affects all things, everything from your thinking and your mood to pain. So it's definitely something that's worth an investment. For a sleep log, you can just Google sleep log and you'll get a lot of free templates where you can track it. You can also use apps, and then that way you can show your doctor like a quick graph and summary of how well you're sleeping. This action thing keeps on coming up on the frame. Okay, so the next thing I want to talk about while we wait for more questions, please feel free to ask questions about anything related to sleep, is something called the 3-factor model of insomnia. So there are a lot of reasons why people have sleep disturbances. And the core of this model, and you can again Google it, it's called the 3-factor model of insomnia. The core of the model is that the longer that sleep has been a problem, the less it becomes about what happened when your sleep problem started, what was going on, and the more it becomes about what's been going on since. So let's use an example of having a stroke, right? So we all have a certain disposition of sleep problems. So those are called predisposing factors. How did you sleep as a child? Did you have a routine bedtime? Did you have a safe sleep environment? All those things either set us up closer to or further from sleep problems. And then we have something that we call the precipitating factors. So that is the event that really changed the way you sleep, where you first started to notice sleep problems. So let's say that's your stroke. So you're either having trouble going to sleep or staying asleep. And both of those count as insomnia. And then, since that's happening, you've started to change the way you sleep because of the positioning, right? Or you're not looking forward to going to sleep, or you're afraid to go to sleep. So now you've had these sleep changes for 6 months or longer, and you go to your doctor, and usually if you're going to talk about sleep or anything, the first question that your doctor asks is, well, when did this start? Or what was going on, right? And although that question is important, it's not as relevant as what's been going on since, right? If you're afraid to go to sleep, then it changes the way your brain approaches sleep. If you've had to change positioning, it's not comfortable, your body gets fixed in those positions. So it's really about what's been happening since. You know, are you drinking more caffeine to put off going to sleep? Are you watching more TV because you can't go to sleep? And all those things start to like feed in more to the sleep problem, if you will, than the actual stroke. And that becomes more and more true the further out you are from your stroke. Okay, so we have some more questions. Or Rosemary said, I have aphasia. When I don't get enough sleep, it affects my speech. Absolutely. So we all wake up with a limited amount of reserves, right? Cognitive, physical, emotional. And your brain puts the resources towards the fires. So fires are, I'm in pain, I haven't slept, I'm angry. So reserves go there. And that means that reserves get taken away from things that are lower priority in terms of consequences for the body. So that is definitely things like clarity of speech, attention, memory, where did I put my keys? Can I deal with this frustrating situation? Because the consequence for those, as frustrating as they are, it's a less detrimental stress state than not having slept well. Angela says, can you explain a little more about the difference in central and obstructive sleep apnea? We did not really understand the difference specifically to stroke. The first few months of home of try to use the CPAP was horrible, and we kept getting told to keep trying. And we did, but this causing him to not sleep was the worst thing to help his early recovery. We now have a pulmonologist that prescribed the BiPAP. Yeah. So central sleep apnea means that the signal from the brain to your sleep centers has been affected. So it's brain-based. The signal is the problem. Obstructive means that the anatomy related to sleep is affecting your breathing. So everything related to the respiratory system in your sinuses or your throat, that is like when you lay down, there's an obstruction. That's the obstructive part of sleep apnea. The getting used to the CPAP is something that is a big issue. The general guidance seems to be to practice wearing the CPAP during the day, and or wearing it like an hour and a half, an hour prior to getting into bed while you're doing something that distracts you or is relaxing, like watching TV. However, watching TV before bed can also impact sleep. It sounds like the pulmonologist, I hope the BiPAP is working better. Another thing to discuss, depending on the severity of the sleep apnea, is using a oral device. So an oral device is kind of like a mouth guard, but it repositions the jaw. So that is more for obstructive sleep apnea, and that is something that your doctor, your sleep doctor, and your dentist can work together to get you the best one. It's not something, there are over-the-counter oral devices for sleep apnea. I would not recommend them. You want to get a custom one made. Melanie says, I can't stand the feeling of it on my face. Yeah, that's a big one. There are multiple reasons. I used to work with service members with PTSD and brain injury, and a lot of them had trouble with the mass sensation on the face. So there are other options. They make, there is some development of like implants for sleep apnea, but there are strips. It's called Provent, I believe, Provent. That's just one example to start your research going. I'm not recommending that necessarily. But that is a strip, so nothing's covering your face. Melanie, I would also recommend talking to your provider about an oral appliance. But just know there are different options than even a CPAP, like depending how long ago you've had it, there have been advances, so they're definitely less bulky, they're less obtrusive, they're designed to be more tactilely pleasing on your face. But you can also, if you have an occupational therapist, or even your doctor, you can talk to them about strategies to maybe increase that tactile input, some desensitization exercises. But yeah, it is, there's no easy answer and shortcut to having something on your face feel comfortable right off the bat. Angela says, I've struggled with everything. I want to sleep and nap all day, frustrated. I'm set to have a sleep study soon. Routine is extremely important to me. I'm glad you're having a sleep study. That's great. Information is power. So even if you don't have a diagnosis that comes out of it, it's going to be a lot of important information. Make sure you sit down with your sleep doctor or any provider to really work through that information. Even if you don't meet the threshold for sleep apnea, how much time you're spending in each stage of sleep is important. So if you don't get enough stage 3 sleep, you're more likely to wake up feeling physically tired. If you don't get enough REM sleep, or stage 4, if you will, you're more likely to wake up feeling mentally tired. So knowing those numbers and having someone walk you through a sleep study is really important. So I would look up some information and also write down all your concerns, because when you go to do your sleep study, they're going to give you a lot of questionnaires. So be able to answer about your sleep habits and take some time to write that down. And you're right, routine is critical. When we're off our routine, we're off our game. It throws everything off. Angela says she's trying to avoid the CPAP device. Yep. But if you do have a diagnosis of sleep apnea, or it has been recommended to you, make sure you talk to your provider about other options. like the lifestyle modifications that they suggest, like losing weight, not smoking, sleeping on your side. Those can only do so much, depending on the kind of diagnosis you have. Thank you everyone for the questions. These are all good questions. Let's see. The takeaway message, I hope, is that there is room for improvement. Right? This is not the way it has to be, but it just like any other change in our bodies or minds, we have to advocate for ourselves, and that means really being comfortable speaking up about how your day has changed. And writing down your questions, and then if you're not comfortable, having someone that you trust come with you to have these discussions with your doctor, not being afraid to speak up and say you don't, you'd like to discuss alternatives, or you'd want a second opinion or whatever. Your healthcare, you're a partner in your healthcare, so definitely don't be afraid to ask questions. So sometimes people ask about supplements, or like melatonin, over the counter or prescription, or even like what foods and drinks or special sleepy time teas they can have to facilitate sleep. Those things can be a part of your sleep plan. Definitely you want to take the guidance of your provider. Like melatonin is over the counter, but every brand has its own dosing instructions, and they're not written by doctors, right? So you definitely want to make sure that you're taking the right dose at the right time. More is not necessarily better, so have a discussion with your doctor. A lot of clinics that do a lot of research, like Cleveland Clinic and Mayo Clinic, have specific guidance on melatonin. So your doctor may follow those, but you definitely want your doctor to be tracking everything you're taking, vitamins included, all over the counter stuff, because some stuff that's meant to help sleep, especially pills or tablets, they have a lot of coatings and they have a lot of dyes sometimes, and those can be inflammatory, and that is not conducive to the sleep process. So make sure your doctor is tracking everything you're taking. In terms of tea, if you enjoy tea and you're, it's part of your bedtime ritual or habit, keep it up. But I wouldn't say, starting something with the hopes of that being like, the solution. You definitely want to look at the bigger picture, which is, how do I feel about sleep? How am I approaching sleep? What are my expectations about sleep? Thoughts are very powerful. It's called cognitive behavioral approach, where how we think about things affects how we approach things. So definitely we can, our thoughts can definitely get in the way, but they can also help. What other questions do you guys have? So if you wear a sling, or you have a brace for your hand, or you wear an edema glove during the day, nighttime wearing schedule can kind of vary depending on the recommendations. So you definitely, our hands tend to, again, it's a comfort position. We tend to get like really small when we sleep, especially if we're uncomfortable or in pain. So if you wake up and you notice that your elbow is bent or your hand is closed, you definitely want to talk to a rehab professional or your doctor about like a splint. So a resting hand splint can keep your hand open at night. A wrist lacer can keep your wrist straight at night, and an elbow extension splint can help you keep your elbow straight at night. Now again, you have to balance like the perceived benefit of this with the comfort. You don't want something that's technically supposed to help with sleep be a hindrance to sleep as well. Does that make sense? So in terms of swelling, if you wake up and your hand is swollen, try to position yourself when you sleep with a thin pillow or a folded towel so that your hand is above your heart, so that the fluid can flow down and out of your hand. Angela says, I don't recommend melatonin. I had nightmares when I took it post-stroke. Scary. So, everyone reacts differently. Even things that are, over the counter or innocuous can have an effect that you don't expect. So definitely the guidance is always check with your doctor or their nurse practitioner, and make sure they know what you're taking and get the recommended dose. But yeah, stuff doesn't work for everyone. I mean, even, everyone knows that eating your vegetables is good for you, and green smoothies are all the rage and stuff, but some people don't react well to greens, right? Some people have allergic reaction. So you definitely want to, everything is, you have to take it case by case. Like, you have to find the best fit for you. You're welcome, Angela. You also want to look at and really think about your sleep before the stroke, right? It's unrealistic to expect that you're going to wake up feeling awesome post-stroke if you had chronic sleep problems before stroke. So you want to make sure that your frame of reference and what you're comparing to is relevant. So it may be a matter of working with your medical provider to kind of, correct or address the sleep issues pre-stroke, and then also your sleep issues post-stroke. What other questions do you guys have? So if we talk about changing sleep habits, the first thing is to start small. Start with a goal that is so small that it seems like ridiculous that it wouldn't happen. So that would be something like, making sure that you're in a dark room when you sleep. They call these general recommendations sleep hygiene, and they really make a difference. People think they're in a dark room, but then if you kind of ask them about like lights from chargers or devices, like those blue or red lights, they're all over the room, and those are really disruptive to sleep, even if your eyes are closed. So what I recommend is either unplugging those or covering those with electrical tape. Watching TV, that is, again, something that, although watching TV doesn't necessarily affect your ability to go to sleep, but it affects your ability to stay asleep and wake up feeling rested, because that light gets broken down really slowly. That blue light, the light that comes off of devices like that. But again, if watching TV is something that is part of your bedtime ritual, it's something that was comforting to you growing up, then you have to balance that, right? Because if we take that as a must-do, guidance, then the anxiety or stress of taking away something that was part of your habit or ritual outweighs the benefit of removing that blue light. So you definitely want to, you can Google it, sleep hygiene recommendations, and go through them and see what's relevant for you. At the end of the day, if it doesn't work for you, it doesn't matter what the research says. Denise says, I'm tired all the time and the forgetfulness, and now I have anxiety when asked too many questions. That is something that we hear a lot, not just post-stroke. And, the system that works for you may not be a system that works for everyone else. I always think it's great to have an advocate. Whenever I have medical appointments that are super important, I try to have my sister, join either by phone or computer, just so I have a second backup person. And I always write, and this is just something that I started getting into recently because the patients I used to work with and the stroke participants that I work with now, it's a lot. It's a lot to keep track of. And the more you're asked about stuff that you're supposed to supposedly know about, or even if you make the appointment, it's hard to keep track of everything. So I suggest writing things down, finding a system that works for you. Some people are pen and pencil, people till the end. Some people are phone people. So find a system where you can write down questions as they occur to you. And then before your appointment or meeting or whatever it is situation where you feel anxiety when you're asked too many questions, use that for guidance. It's a way to empower yourself, and it's a strategy to use, work smarter, not harder. But you have to find a system you're comfortable with and don't feel self-conscious about. But yeah, a lot of anxiety is common when your brain is healing. And the healing journey, there's no timeline on that. We all heal and we also all grow, stroke or no stroke. There's no time limit on that. But if you're tired, you have less to give before you get overwhelmed. So understanding that and giving yourself grace about that is very important. Flavio Christina Alvarez. Oh, hey, Christina. I wake up now and I have to go to the bathroom now. Any ideas? If that is something new since the stroke, or even prior to the stroke, that is definitely something you want to discuss with your doctor. It's called nocturia, having to wake up and use the bathroom more than once, or frequent urination, or if you go to the bathroom and you feel like you have to go to the bathroom but you actually don't end up going, nothing comes out, you definitely want to discuss with your doctor. Some of the medications prescribed post-stroke, whether it's for spasticity or seizures or whatever, sometimes that can affect frequency of urination or sense of urgency. So definitely talk with your doctor. But yeah, it's very disruptive to sleep, for sure. Denise says, it's like I have dyslexia, a lot of back pain now. My symptoms were in my lower back. So is that, Denise, is that post-stroke, or is that kind of something you're just noticing now? It's kind of it can be a frustrating loop if you get hurt for whatever reason, that as soon as one area starts to improve, you may notice a lot of other stuff that feels uncomfortable. And that's because when your brain gets freed from all the attention it was putting on the thing that was bothering you the most, it puts its attention to the other things you weren't noticing so initially. So that can be really frustrating. It's like, well, I went to therapy, I'm getting better, but now I notice all these other things. It's a process. It's a process, and it's frustrating, and there are no easy answers. And you just want, make sure you have a good team around you, and make sure you have a place for your feelings about it. Because unfortunately, it's not a user-friendly process. But we all get older, right? Stroke or no stroke. And as we get older, the way our brains and body work changes. So sooner or later, we all have to change the way we approach things if we want to keep on doing what's meaningful to us. Audrey says, a family member has said my stroke survivor husband needs to be on a schedule, like at 9 a.m. he wakes up and has breakfast. My contention is if he sleeps, let him be. He needs it. Is that correct? So there's no real, I can't answer that with any definitive answer, because I don't know the medical history. There's a benefit to a routine. There's also a benefit to sleep. So what I would say is definitely have a discussion with your medical provider, because they're the ones to give you the best guidance on how much sleep is too much, depending on how far out they are from the stroke, right? Because sleep is, yes, my brain is healing, yes, I need it, but sleep can also be a symptom of, right, boredom, or feeling sad, or not feeling like you have a routine or a purpose. So more sleep could also be a symptom of that. So it's definitely looking at the whole picture, and then discussing with your medical provider, and discussing as a team, spouse, a stroke survivor, and medical professional, deciding as a team like what is going to optimize daily life and quality of life. And sometimes that changes. Some days you need more sleep, and that's just the way it's going to be, and that's going to be the most beneficial for your brain. And some days you need to kind of get yourself out of bed and start doing something that's meaningful to you. Easier said than done, for sure. But in general, a routine is good for the brain, and sometimes that routine includes more sleep than you were used to prior to stroke. You're welcome, Audrey. I think these questions also and comments also highlight that, you're the expert on yourself, right? No one knows what it's like to be a stroke survivor in your body better than you. So really feeling empowered with that and making sure you're heard. Because people can give you, research can say whatever, medical providers can give guidance, but ultimately, you know what's working for you and you know what's not. And that's all you need to get started. You don't have to know the fancy language or the correct way to approach something. You just have to find a way for one person on your team, medical or non-medical, to share your concerns with. And hopefully that gets the ball rolling. The brain is fantastic, though. As complicated as it is, and as much as it can complicate our lives, it's also incredibly resilient. The concept of neuroplasticity is that our brain can always change. They used to say that, after a certain age, it is what it is. You can't teach an old dog new tricks. And now we know, as long as you're moving your body, as long as you're breathing, your brain can change. Your brain can keep you engaged. Social support is a big part of that. Knowing you're not alone, knowing that if you need help, someone is going to be there for you. And it's communities like this, right, where you can reach out to fellow stroke survivors or share your experience, that can help create your village for you. Okay. Lynn says, that happened to me after my stroke. I'm only 42 now. I never used to get up. Now I'm up every 3 hours when sleeping. But I have to head to the bathroom every 2 hours so I don't pee myself. I was 39 when I had a severe stroke. Yeah. Going to the bathroom frequently is, it can be a purely, bladder related, urinary system related thing. It can be a post-stroke thing where, your body's uncomfortable and it's just trying to get your attention. And so every cue and signal it can give you gets fired off. That's why sometimes you feel like you have to go to the bathroom, but nothing happens. It can also change as a result of aging. So that's why it's important to really have a clear medical picture of what's going on. And when to be concerned about something to the level that you need to get it addressed professionally versus when it's something that's just your body recalibrating. But definitely, if getting up to go to the bathroom is disrupting your sleep, which every 3 hours is a lot, definitely have a discussion with your doctor. And also have a discussion, pharmacological interventions, medicine, are only one piece of the picture. Also have a discussion about lifestyle changes that could be, be impacting the picture, even cognitive, and emotional. I, talk a lot about feeling your feelings. Just because you don't talk about them and ignore them doesn't mean they go away. Your body will get your attention some way. And those ways can be, surprising, but your bodies will yell at you if you don't take care of yourself. Denise says, thank you for speaking with me. I don't have the money to go to therapy. Denise, depending on where you are, there are lots of support groups that you can find online. So if you go to the American Stroke Association support group finder, you can put in your zip code and all your local support groups will come up. And forums and resources like this on Facebook, the American Stroke Foundation, or any other stroke group, always know that there's a place for you to reach out. Lynn is talking about being in the same boat as having to get up frequently for going to the bathroom. Melissa says, my son had a stroke 2 years ago. He can't speak and his right arm is weak. He stays depressed because he was a very active person with 4 children. I pray hard for him. Yeah. It's not just being a stroke survivor, it's being family members or friends or a caregiver of someone who had a stroke. And definitely that loss or change in who you were, and how, your roles in your life, whether you were a dad, a brother, a son, a coworker, that's a big change. And talking about it is important, and also knowing that, roles change, and finding a way to reconnect is always a valid goal. 2 years out of their stroke or even more. So talking to his care provider and getting in touch with a behavioral health professional to help kind of navigate that is one option. Even doing family therapy. But depending on the age of children, it's hard. It's hard to understand why, dad is not the same as he used to be. Or, children just have all ages have a different way of understanding what's happening around them and rationalizing it. So it definitely is, it's definitely something that is hurtful and overwhelming and all of those things. And you want to make sure you have a space for that. Lynn says, thank you so much. Your input is appreciated. You're welcome. Angela, this has been wonderful. Thank you so much. I have to go. Bye, Angela. Thank you for joining us. Okay, so next week on Thursday at 11 o'clock, we will be doing this again. And the topic will be chronic pain post-stroke, and chronic pain in general. It is very important to be familiar with and understand the difference between acute pain and chronic pain. Acute pain is when your body is giving you a signal that something hurts because there is an imminent threat of injury. Chronic pain, which I'm sure a lot of you have experience with, is when there's no longer a threat of tissue injury, but you're still perceiving the pain. And that is a different thing. That is your brain and your pain receptor system changing. So I definitely, it's a topic I'm very passionate about, because you want to make sure that when you hurt, you're going to your provider and having the discussion that ends up being most productive. So chronic pain versus acute pain, and strategies and changes post-stroke related to pain is what we'll cover next week. And then the week after that, as building up on that, building from that discussion, we will talk about tone and spasticity post-stroke. So we know that tone and spasticity is a big contributor to chronic pain. And so we'll have some information on what those things are, what's actually happening in your body, and exercises and tips and strategies that have worked for people. For suggestions for future sessions, please write in the comments. We want to hear what would be useful to you. Suggestions on topics, suggestions on, what we can do as you know, from the American Stroke Foundation, we really want to increase our virtual and online offerings to offer support to chronic stroke survivors and their caregivers. So please let us know how we can support you. Let us know. Let us know what areas are missing. Let us know what you wish you would have known earlier. We are eager to hear from you. Okay. Anything else? We are getting ready to wrap up in a few minutes. Can you write questions after the post is?
You should be able to either comment or they can just message.
Okay, so if you comment after this presentation is over, or if you message us on our website, americanstroke.org, or on Facebook, I will make sure to get back to you. I want to make sure that everyone has a chance to get their comments and questions heard, because we're all about supporting everyone, supporting each other, right? And if you would like to share some tips or strategies that we can share with other stroke survivors, please let us know as well. Hi, Linda. Linda says, I had a stroke 8 years ago. Linda, do you have any specific questions or comments? You know, we used to hear a lot about a timeline, about 6 months to a year in terms of recovery and kind of being where you're going to be. And we know, and I hope Linda has had an experience where she continues to improve in the areas that are important to her. Really finding your network and finding your village and having other stroke survivors to talk to. Like, your whole life doesn't have to be medical, right? You're not a stroke survivor is not your identity. It's a piece of the story. It's a chapter. Okay. Well, thank you everyone for joining. Thank you for the questions. Please feel free to comment and ask us questions on Facebook. Visit our website, americanstroke.org. We also are on Instagram and YouTube. If you have ideas on what you would like to see on those channels, please let us know. Okay. Have a good rest of the day. Bye.